Bien, bonjour à toutes et à tous. Merci d'être venus pour cette chaire d'Alembert. Donc on a, en fait c'est un rituel maintenant sur Paris-Saclay d'avoir une leçon inaugurale pour tous les scientifiques éminents qui sont invités par l'Université Paris-Saclay dans le cadre de ce programme de chaire d'Alembert. Et moi, si j'interviens aujourd'hui, c'est en tant que responsable du département Sciences de la vie de l'Université Paris-Saclay. On a, depuis le début de ce programme de chaire d'Alembert, reçu un certain nombre de demandes de la part de collègues de Paris-Saclay qui sont désireux d'accueillir dans leur laboratoire des personnalités normalement étrangères, ou en tout cas travaillant dans des laboratoires étrangers. Et il y a une sélection, un processus de sélection, d'évaluation et de sélection qui s'opère. Au sein du département SDV, on reçoit les projets, les dossiers des candidats, on les priorise. Ensuite, tous les départements se mettent ensemble, les responsables de département, pour discuter de chaque priorité au sein de chaque département. Et puis on a un certain nombre de possibilités d'accueil en fonction du nombre de mois de chaque visite. Et ensuite on sélectionne la short list de ceux qui sont retenus au final. Et donc le professeur Frézard fait partie de ceux qui ont été retenus. Maintenant c'était en 2017 je crois, où la sélection a été faite et vous êtes arrivé en 2018
En fait, la sélection était en 2016 et je suis arrivé en 2017.
C'était décalé, d'accord. Et donc, c'est un plaisir de vous avoir. Alors, on a déjà eu l'occasion de vous faire intervenir dans d'autres circonstances, au niveau de l'IPSIT en particulier. Donc, aujourd'hui, c'est le jour de cette leçon inaugurale. Et le laboratoire d'accueil, donc c'est Bio6, que dirige Bruno Figada, et dans l'équipe de Philippe Loiseau, qui est l'équipe parasitaire. Et donc, sans plus attendre, je vais passer la main à Philippe Loiseau, qui va vous présenter le parcours, le CV du professeur Frézard, et introduire sa leçon inaugurale. Voilà, merci à vous.
Merci beaucoup, Rodolphe, pour ton introduction et ton soutien dans cette opération. Now we switch in English, and I am pleased to welcome you this morning. Good morning, everybody, for the inaugural lesson by Frédéric Frézard about antiparasite drug discovery and the OneHealth concept. So, the question could be, why a chaire d'Alembert Paris-Saclay in the field of antiparasite control? If you look at the slogan of Université Paris-Sud, you have comprendre le monde, construire l'avenir. And building the future requires improving life conditions worldwide. And this is the job of all the research to improve life conditions. And among parasitic disease threatening human and animal health, the field of parasitism is a little bit specific. It encompasses a relationship between organisms where one benefits at the expense of another. And what is fascinating in the world of parasite, these are the interaction, molecular interaction between the parasite and the host. And this is a complicated interaction, these are complicated mechanisms, but so much fascinating, because there is always a fight between the parasite and the host. And sometimes the host is able to accept the parasite, and after he reacts, and in several steps. So, some parasitic diseases are presently emerging in some countries, in some areas where they did not exist previously, because it is the consequence of movement of population consecutive to conflicts of wars, and also climate warming. Climate warming is an essential factor which can provoke this emergence or re-emergence of parasitic disease where they previously disappeared. So one of these parasitic diseases, Leishmaniasis, are considered neglected tropical diseases by the World Health Organization, and we need a strategy of control. The strategies of control are not optimal, and we need to optimize them. So, have to know the therapeutic strategies. Consider from one side only medical aspect, on the other side veterinary aspect, without discussion between both the field, without any significant interaction. And this lack of connection progressively disappear because for parasitosis, which are common to human and animals, there is a problem of drug resistance, and drug resistance emergence, drug resistance consequence, drug resistance management require to consider not only human from one side, animal on one side, but human and animal and their environment. And Frédéric will give you some example where the environment is capital, notably at the drug resistance level. And this drug resistance problem paved the way for the One Health concept. Not only, but contribute to pave the way of the One Health concept. So, how to be One Health? It's a large debate, how to be green, how to be One Health, and big challenges with so many approaches. I consider I would give you only an example considering chemistry, because as said Justus Liebig, alles ist Chemie, everything is chemistry. And the basis of all the drug we are using for human and animal health have to be synthesized. And now there is some challenges to have the practice of green chemistry, for example, reaction in water, to prevent the use of toxic solvent, and also the problem of recycling of residue from chemical synthesis. And if we take the example of Région Île-de-France, Région Île-de-France, drinking water comes essentially from 3 rivers, River Seine, River Marne, and River Oise. And you know that in France we have a very high quality of water. You can filter, you can manage all the microorganisms, you can manage parasite by filtration, you can manage bacteria, you can manage virus, but you cannot manage molecule up to date. And this is a problem because all this water coming from the rivers contains pesticide, and as soon as we are treated for a disease, all the drugs are metabolized and go in the wastewater and cannot be purified in the treatment system of water. So from year to year there is an accumulation of drugs in water. And why is this explanation? Because Frédéric Frézard will explain you that the quality of water could have an impact on the treatment of Leishmaniasis and at the level of drug resistance. So just some more to introduce the host laboratory. I am Philippe Loiseau, responsible for Team 4 of Biosys unit, antiparasite chemotherapy, also the acronym is PARACHEM. And we are a team involved in chemistry, biology interfaces. We are 5 biologists and 1 chemist as permanent, and we have also non-permanent staff, including postdoc scientists and PhD students and master students devoted for the new treatments against Leishmaniasis. So we have 3 topics, 3 complementary topics, 3 very linked topics. The first one is about drug target, and we are working on the identification and valorization of therapeutic targets. These are proteins to identify new anti-leishmanial candidates, less toxic, and we hope with less resistance emergence possibility. So the second aspect is drug resistant. We are studying drug resistance approach through OneHealth consideration to understand the resistance transmission. And you will see that Leishmaniasis include an insect vector. So you have the host, animal or human, an insect vector. And we have to understand the behavior of resistant parasite along the life cycle of the parasite. And the third aspect is drug targeting. Drug targeting is important to be developed because, as I say, the compounds are toxic, and we have to target the compound where it should act, where the parasites are located. And drug targeting is an interesting approach we develop here at the faculty with Institut Galien. We have the chance to have high specialists in this question. And this is also the main collaboration with Frédéric Frézard, because we have identified a common convergence, a common aspect of the research which could be synergized. So drug targeting is the aspect of this morning, of this lesson of Frédéric Frézard. And now I have to introduce Frédéric. Why Frédéric Frézard is an ideal recipient of a chair d'Alembert. I invite him some years ago in 2015, where I was president of EU Coast Action, and he gave a conference, he delivered a conference of high interest, and we have a discussion allowing to identify convergent approach, complementary approach, and we decide to develop a collaboration. And this collaboration was first developed through a PhD sandwich, and the sandwich is here. This is Julian Souza-Lanza, and very successful sandwich because a brilliant student, which have then recruited as temporary teacher researcher, and now from next September recruited as postdoc in our team. And the project, the common project we have with Frédéric is to develop, to create an associated international laboratory, LEA, focused on anti-leishmanial chemotherapy between BioSys and the University Fédérale of Minas Gerais. So, who is Frédéric? Frédéric is a professor, full professor, at the Department of Physiology and Biophysics at the University Fédérale of Minas Gerais at Belo Horizonte in Brazil, and he performed studies for the training in France. He has got his PhD in biophysics at University Paris-Saclay, now the name is Sorbonne University, and he performed a postdoc fellowship at University of Florida in US, then a second postdoc through CNRS industry collaboration at University of Nice. And he has got his management research ability, habilitation à diriger des recherches, at University Paris 13. He was invited researcher at the Fundação Ezequiel Dias in Brazil, and he was during several years visiting professor at University of Paris Nord. Now he's in Paris Sud, so Frédéric is everywhere now in Paris. And in 2007, he has a postdoc at Virginia Commonwealth University in US, then associate professor, and now full professor since 2013. And since 2017, he is a recipient, the laureate of the chair d'Alembert of Université Paris-Saclay. What about the academic administration activities of Frédéric? He was the head of the postgraduate program in biological science, physiology, and pharmacology. All this academic administration were realized at the University of Minas Gerais. Then he was head of the professional master in biopharmaceutical innovation, then coordinator of nanobiology network for the whole state of Minas Gerais. And since 2015 is the president of the funding committee of the PhD program in biopharmaceutical and technological innovation. So what are the main contributions of Frédéric to science and technology? He has published 129 papers. He has written 9 book chapters. He has got an H index of 36, and he was supervisor of 10 PhD and 11 master theses. What is amazing, what is outstanding also, this is the capacity of development from his research, because he has 22 patent applications, 10 of them were granted patents, and 3 of them licensed technologies. And up to now, he has always one marketed product. And he was co-founder of 2 startups, Labphare and Alamantec. So now, after this introduction, I am pleased to give the floor to Frédéric Frézard for his inaugural lesson, Chair d'Alembert, entitled Antiparasite Drug Discovery on OneHealth Concept. You are welcome. Frédéric, please go ahead.
Well, good morning to all of you, and welcome you for this inaugural lesson. And I would like to thank Professor Philippe Loiseau for this nice introduction. And I also thank the University Paris-Saclay for granting me this Chair d'Alembert. And so it's a great pleasure to be here, and a great honor also. My talk will be focused on antiparasite drug discovery, and this is in fact related to, this is a subject of the project, the collaborative projects that we are developing with the group of Philippe Loiseau. And I will give many non-conventional approach for this subject using the One Health concept. And I will show you that the One Health concept will really help us to understand the emergence of the parasite disease, the emergence also of drug resistance, and finally it inspires also us regarding the strategy to be adopted for the antiparasite drug discovery. So this is the outline of my talk, and so I will briefly introduce the One Health concept. I will focus on one parasite disease. It could be considered a model of parasite disease, and I will try to draw some general concept based on this disease regarding emergence and drug resistance also. And then I will describe the strategies of control, the existing drugs and the limitations. I will describe the main drug discovery approaches, and our own contribution, the contribution of our group to the field, and also the perspective mainly regarding the collaborative projects that we develop with Philippe. So the One Health concept. It is clear that humans and animals share the same ecosystem, and sometimes they also share the same pathogens and their related vectors. So this means that we can have the transmission of some pathogens and the related disease, because usually they can cause diseases, from animals to humans. And there is a clear, important dependence of the health of humans and the health of animals. And both of these will also strongly depend on the environment. So this is basically what is the One Health concept, what is englobed the One Health concept. And so the One Health concept was introduced, it's relatively new. In fact, its implementation is still being done in response mainly to health threats, mainly infectious disease, and as a world strategy to expand how the interdisciplinary collaborations and communications on all aspects of healthcare for humans, animals, and the environment, and this to achieve some joint solution. You certainly know these major health threats, which is re-emergence of zoonoses. Zoonoses are these diseases are spread from animals to humans. I will emphasize this in the case of Leishmaniasis later. But these are well known, for instance, with avian or bird flu, Ebola, arbovirosis, and this parasite, specifically the parasite disease, which is Leishmaniasis, but many other diseases also. And but this certainly, in the stories, they have had a more important impact regarding the threats. And emergence of antimicrobial resistance is also a great concern. And this is due mainly to uncontrolled use of drugs. And the fear that this, some drug resistance pathogen may be transmitted from animals to humans. And so this is a great concern. And food safety hazards, for instance, the mad cow disease, so you certainly know. And most of these health threats emerge from human activities, this on the environment. So, as you know, industrialization, population growth, geopolitical problems will affect the environment. And this, in turn, will affect the health of animals and the health of humans. So now Leishmaniasis. Leishmaniasis is a disease caused by protozoan parasites, which is named Leishmania, and there is in fact different species of Leishmania. Here you can see the name of some of the species. There is 20 species. So Leishmania major, Amazonensis, Guyanensis, Brasiliensis, that are found in different parts of the world. Infantum, Donovani. And this parasite are transmitted to animals and humans through the bite of a sandfly. And for instance, in the case of this species, the clinical manifestation in humans will be cutaneous or mucocutaneous leishmaniasis. And an important aspect of this disease, this manifestation also, is the fact that wild animals act as a reservoir. What does this mean? This means that the sandfly to become infected will become infected only by biting these animals. So these animals are infected, the sandfly will become infected by biting these animals, and then will infect the human. So the sandfly will not become infected directly by biting the humans. So this reservoir is very important for the transmission of the disease, and its control also is very important. We have also another form of the disease, another clinical manifestation, which is in humans, which is visceral leishmaniasis. And visceral leishmaniasis will affect mainly the internal organs, like the liver, the spleen, and the bone marrow. And in this case, also in the case of the infection by Leishmania infantum, which takes place in the south of France and also in Brazil, the dogs act, mainly domestic dogs, act as a main reservoir of the disease. And in this case, it is also, as we say, when you have an animal that act as a reservoir and contribute to the transmission. We called it a zoonotic transmission. But we also have, in the case of visceral leishmaniasis, anthroponotic transmission, which means that the sandfly, and in the case specifically of Leishmania donovani, the sandfly will become infected by biting directly the humans. So in this case, you don't have a reservoir. You have a direct transmission from human to human. And this, of course, has some implication for regarding, for instance, drug resistance, as we will discuss later. Now, in the case of all hosts, I would say mammalian hosts, so for instance, the dogs and humans, the parasites will be localized mainly in the macrophages and will reside and multiply inside this cell. So it's in the form known as mastigot form. Now, what is the geographical distribution of the disease, of these diseases? Because it's a group of diseases, in fact. Cutaneous leishmaniasis here and visceral leishmaniasis there. So, as you can see, both of the diseases affect many regions of the world, and in fact, 4 of the 5 continents. If you look in South Asia, in Africa, South and Central America, and this happens both for cutaneous leishmaniasis and visceral leishmaniasis, but you have the difference in the localization. In fact, for instance, if you look at Brazil, in Brazil we have both forms of the disease, and the brown color means that it's a region that has higher incidence. So we have both, and with high incidence, both forms of the disease. In France, you see you have a lower incidence, but both much lower, in fact, but both also are present, both cutaneous, many cases, in fact, in the south of France, cutaneous and visceral leishmaniasis. So worldwide, it's 1 million new cases annually, 30,000 deaths each year, and these deaths, in fact, are mainly due to visceral leishmaniasis. I did not mention this, but visceral leishmaniasis, if not treated, it will be fatal. So in 95% of the case. So it's really a great impact on the. It really contributes to the higher mortality of the disease. And it's estimated 1 billion of people that live at risk in the world. I will discuss or present here 2 examples of reemergence of the disease, of this group of disease. And these 2 illustrators, those how the OneHealth concept help us to understand this reemergence. So, for instance, this was presented in the last Congress of the French Society of Parasitology, and the case of cutaneous leishmaniasis caused by Leishman major that emerged in the central Tunisia in 82, and in the region that did not exist, did not exist, and now it has expanded to South Tunisia with a very high incidence. And what is explanation for this emergence is increased population of the natural reservoir, and this is the main reservoir, and it is a rodent, and also of the population of the vector. And this is, in fact, related also to some interference of human activities on the environment. And it was the construction of a dam, agricultural activities, including irrigation. So this was the first cause of this reemergence. The second case that I will present is the case of Brazil. So the expansion of visceral leishmaniasis in Brazil. Brazil is divided in 4 main regions: the northeast, the north, central, west, southeast, and the south. And initially, visceral leishmaniasis was mostly restricted to the rural zone, and also to the northeast region. And but with time, we had two important changes that took place. First, the urbanization of the disease. So it came to the city, the periphery of the city, and the expansion to the other region, as we are showing in the last 10 years. So in most of all the regions, it has increased, the number has increased, and only in the northeast that we have a small decrease. In fact, it looks like a big decrease, but here the scale is a small decrease, but tendency to decrease. And how we can explain this change? So I was explained by basically the change in the vector habitats. The domestic dog became the main reservoir, mainly due to urbanization, and also the compromised host system because of malnutrition, of HIV, co-infection, because it's visceral leishmaniasis is an opportunistic infection in the case of HIV patients, and this can be also is of course related to human activities like unplanned urban expansion, inadequate housing and sanitation, population migration, marginalization, deforestation, and global warming. And this, you see in Brazil, the number of cases of co-infection, of visceral and HIV co-infection is still increasing. It's a big difference from Europe including, but there is some specific explanation for this. So this also contributed to the expansion of the disease. Now, of course, we need to have some methods of control. If you see this scenario, some strategies of control are needed. And what are these strategies? So there is some epidemiological surveillance, monitoring, evaluating the human case, the vectors, the reservoirs, and also the treatment, the efficacy, toxicity. So these are important aspects that need to be followed and monitored. The vector control is one of the main strategy of control through insecticidal spraying and the use of nets also with insecticides. In the case of human case, the diagnosis as early as possible and treatment, health education activity for the population, but also for the health care staff. And in the case of the reservoir, which is the existence of a domestic reservoir, at least in the case of visceral leishmaniasis, which is domestic dogs, so there is some also strategy to control the reservoir. So for prevention, for instance, vaccination has been implemented in Brazil, insecticide collars, and diagnosis and treatment or euthanasia. I will discuss these two options. And in fact, all of this strategy action should be taken all together in an articulated form. And this is really challenging for the healthcare system in Brazil. Now, what are the existing drugs? I talk because my presentation will focus mainly the drug aspect. And so what are the existing drugs and the limitations? So pentavalent antimonials are the first-line drugs in Brazil in the form of meglumine antimoniate, so to treat all forms of Leishmaniasis, but it is also used in North and East Africa. So it was, in fact, it is the oldest drug. It was started to be used in the 40s. And in Europe, it has been used in the treatment of dogs in combination with allopurinol, another drug that we have a synergistic effect between both of them. And unfortunately, this drug has several side limitations. So it's a prolonged treatment with daily injections, toxicities, drug resistance. It's a serious problem in some part of the world. I will discuss this. And the need for parenteral administration. Metefosine was introduced more recently as a first oral drug for Leishmaniasis, but also with some shares about some of the limitation of pentavalent antimonials. So it is used in South Asia and in Brazil and Spain in the treatment of dogs, also in association with allopurinol. Third drugs used is paromycin. It is used in East Africa and South Asia, and it shares the same limitation as pentavalent antimonials. And the last drug, so it's only 4 drugs, fortunately, otherwise it will be very full of this. But here, so it's amphotericin B in the liposomal form, and it has also it shares also some important limitation like toxicities, resistance, but to a lower level than the other drugs. It is also parenteral, and but it has some specific limitations that limit its use in developing countries, which is a high cost and stability problem. So it has been used in Europe, South Asia, and US as a first-line drug, and in Brazil only as second-line drug. So this is what I would like to emphasize a bit more, because it has really been studied, the emergence of antimony resistance in some part of India. And I think it's important also because we see how the OneHealth concept helps us to understand this emergency. And so the failure rate in antimonial therapy has reached 50% in this region. So they are not used anymore in this field. And the classical model to explain the resistance, the appearance of resistance, is drug misuse, either inadequate or interrupted treatment course, and also associated to anthroponotic transmission of visceral Leishmaniasis, so human to human, which makes much more easier the transmission of resistance parasite to one human to another. And but there has been another model that was proposed, which can be, in fact, can have two models coexisting, which use, in fact, the OneHealth concept. So it has been observed that in the environment in this region, there is a high arsenic concentration in the groundwater due to geogenic and anthropogenic factors. So both of them can contribute. And this has led to the chronic exposition of humans to arsenites, and leading to the appearance of arsenite-resistant parasites. And as we know from in vitro studies, arsenite-resistant parasites are usually also cross-resistant to antimony. And this is not surprising because arsenic and antimony belong to the same group 15 in the periodic table. So they have very similar chemical and biological properties. And here in this map, we can see, we are showing, in fact, with blue and black points, overlapped black points, we are showing the region where you have the coexistence of antimony resistance and arsenic contamination of the groundwater. So it's very interesting to see these two models, and in fact the contribution also of possible contribution of the environment in the appearance of resistance. Now, as Philippe told us, there is this disease are classified as a neglected tropical disease, and there is some of the most important are presented here of this neglected tropical disease, and according to WHO, it's affect 1/6 of the world population, and there is some common feature between this disease. First, they tend to affect the poorest people in the usually the less developed countries. People who live in remote areas, marginalized people, voiceless people, and who in fact will have a limited access to the existing drugs. So very often the treatment is interrupted. There is a lack of compliance with the treatment. And as we see in the case of Leishmaniasis, there is few and all drugs usually in the case of all this disease, and with limitation, like many side effects or lack of toxicity, drug resistance. And why we have few drugs? Because of the low interest in drug development for this disease, which come from the pharmaceutical industry that has a low interest in developing drugs that will be for poor people that will have some difficulty to pay for this drug, or the government that will have some difficulty to pay for these drugs. Also, the insufficient commitment of public authorities in these countries. And this is this illustration of the demonstration of the low interest. So you see from 1975 to 2004, among the 1,500 drugs, new drugs approved, only 1.3% were for neglected disease. And more recently, 2000 and 2011, again, only 1% of the new chemicals entities that were approved for all disease were for neglected disease. And even though this disease accounts for 11% of the global disease burden. So it's really a complicated situation. And this is why, although this organization was, non-profit organization was created, which is Drug for Neglected Disease Initiative, and that has introduced a research and development model based on 4 pillars. So patient-centered, needs-driven approach, commitment to equitable access to treatment, open access to knowledge, financial and scientific independence, and building of solid alliance with the public and private partners. And this is really important, I think, initiative, because the NDI was able to connect and bring several important actors together, the governments for emerging economies, pharmaceutical companies, funders, and the NDI does not have its own laboratory, but it uses established local competences of public sector research institutions worldwide, and in also several fields that contribute to the drug development: chemistry, pharmacology, parasitology, pharmacy, epidemiology, medicine, infectiology. And by this way, the NDI was able to go from preclinical research, clinical trials, and large-scale implementation. I will show you some of the examples. So just summarizing it, so what is the situation for Leishmaniasis? We have very few drugs available. Drug-resistant toxicity are major concerns for all drugs in use. And I did not mention this too much, but drugs are usually less effective, all these drugs, in immunocompromised patients, like HIV patients or patients that suffer from malnutrition. And so immediate solutions are needed. And what has been implemented relatively recently is the combination therapies of at least two drugs. And so these are some of the combinations that have already been implemented. For instance, in East Africa, antimonials plus paromomycins for visceral leishmaniasis. And what is the gain of this combination therapy? So you have a shorter treatment, lower toxicity, and a lower risk of development of resistance. So it's so this, for instance, was a contribution. In fact, these two combination, ambisome also with metefosine, was a contribution of DNDi. And so there is several combinations of the existing drug, ambisome also with plus paromomycin plus metefosine. Now, medium strategy has also been sought or been also there is research in this field. So in the drug repurposing, and the proof of concept that this is a strategy that is effective strategy is that, for instance, ambisome, paromomycin, and metefosine are repurposed drug. They were first used for another indication. Also, the use of new formulation for existing drug or drug nanocarrier is also a very interesting strategy to improve the existing drugs and prolong their life in the treatment. So, and one good example is ambisome, that is a liposomal formulation. So I will just give a bit more details. This is in the case of the importance of the strategy of drug nanocarrier for visceral leishmaniasis. So this nanocarrier can, for instance, encapsulate a drug, and what is known that when they are in the circulation, they are rapidly cleared from the circulation by the macrophage from the liver, spleen, and bone marrow. And in fact, this is the same cells and the main infection, locale of infection in the case of visceral leishmaniasis. This means that you will improve considerably the efficacy of the drug for the administration in the nanocarrier formed. And another aspect also is that this nanocarrier does not cross the continuous vessels present in the heart, kidneys, and brain. And this means that we'll have a reduced concentration in these organs and a reduced toxicity, because most of these drugs has toxicity on these organs. And a case of success and is of, as I mentioned, is ambisome. And ambisome was effective as even a single dose. So a single dose. Due to the reduced toxicity, we could was administered a very high dose. So what is the benefit is a shorten of the treatment. Treatment is shorter and higher efficacy and less propensity also to develop resistance, drug resistance. Now, long-term strategy are also important and need to be implemented. So new chemical entities need to be developed for this disease. And I would ask on which basis. So if we look on all what we learn from the field, we would prefer, of course, to look for drugs with low potential of reduction of resistance. And it's important when in drug screening part or preclinical studies to incorporate this evaluation in vitro and in vivo in the drug development strategies. And this is one of the strategies that in fact is used in the laboratory of the group, in the group of Philippe Loiseau. Another aspect also, it's due to the context of a neglected disease, it's oral drugs or topical drugs for cutaneous leishmaniasis, it would be preferred, and with a short course treatment. So this would be ideal. Now, biodiversity is one of the source of new drugs, and I would say that it's biodiversity fits very well within the OneHealth concept, because it's a form by which the environment can contribute to the development of solution for the disease. And so there are different strategies. You can use plant-derived natural products, so phytotherapics, molecules purified from extracts, animal or plants, and bio-inspired synthetic or semi-synthetic drugs. And it's really an important strategy because you look at the drugs that have been approved in the period of 81 to 2010. Half of them were from natural origin, so they were bio-inspired. And the fact also that the Nobel Prize in Physiology and Medicine in 2015 was awarded to researchers that discovered natural compounds for parasite disease is also, I would say, reinforce this idea that it's really still an important field. And so ivermectin, for instance, was developed for parasite from infections, and artemisinin for malaria, so saving a million of lives. Now, I could add here, those, and would like to point is that in our collaborative project, we have chosen one of the molecule or bioactive molecules that we have chosen is as to substitute quinoline, and which are derived from natural product. And it is based, as shown by the group of Philippe Loiseau, on our choice is based on their low propensity to develop, to generate drug resistance. But the OneHealth approach reminds us, don't forget the dogs. And so so far we were speaking more about humans, so the human strategies and dogs. So to address this question, so we have to come back to the zoonotic visceral leishmaniasis and the control of this disease, and also the prevention of drug resistance. So, in fact, there is two options for dogs: euthanasia or treatment. And it's a serious and complex question, in fact, as we'll show you. And I think it requires a OneHealth approach. Let's explain a bit more. So just remind you here, so when you have all these participants to the transmission, to the cycle of the parasite, the transmission of the disease, so if you treat a dog with some determined drug, you can induce a drug-resistant parasite. So this has been shown, for instance, for antimonial drugs. And then there is a risk that this drug-resistant parasite through the sandfly reaches the humans, and then humans will stop responding to treatment to the drugs that was used in dogs. And so you can in fact induce resistance in humans for treatment of dogs. And this is really an important question because in in fact, drugs available for dogs are the same as for humans. So it's antimonials, methoxyfene, and this really may happen. And there is few drugs available, as we said, and an additional complicating factor that none of these drugs really has efficacy in dogs. They only lead to partial. They only have a partial. They do not lead to cure of the disease in dogs, and differently from humans. And so all these aspects make that that in Brazil from 60s to the 2016, treatment was not allowed, and the only option for dog was euthanasia. And now, if we look at the effect of this euthanasia, we can see if you euthanize the reservoir, we will block the transmission, or may block the transmission. But in fact, when we look at this strategy of control was not effectively controlling the disease spreading, as I shown for visceral Leishmaniasis. And now, is it effective to prevent the emergence of drug resistance? We don't have the answer. Why we don't have the answer? Because we lack scientific evidence about the possibility of transmission of parasite, drug resistance parasite to humans. We don't have this information. So it's quite complicated situation. Now, I would say, based on these observations, that canines visceral Leishmaniasis looks like also a neglected disease, and not exactly on the same basis than the human disease. For instance, usually the dogs that the disease is in fact not related to poverty. It's related to usually bad health condition of the dogs. There is many, for instance, in Brazil, there is many abandoned dogs, and even the dogs that have some owners, maybe the health condition is not so good. So it also depends on the condition of life of the people. And another point is, if we think about why it is neglected, would be neglected, because, for instance, veterinary industry is interested in developing drugs for Leishmaniasis, visceral or canine visceral Leishmaniasis. I think it would be a quite lucrative business. But I think the reason why it's not a priority, it's mainly because of the authorities, public health authorities, I think, consider that it's not priority, neither for research or, and so it's. I think it's we can consider that it's a neglected disease. And so, as I show you, we can from what we describe. I think the OneHealth concept bring us or inspire us for some important strategy. I think we urgently need to evaluate the risk of zoonotic transmission of drug-resistant parasites, and also urgently need to develop new drugs, drug combination, drug formulation, for effective treatment of canine visceral Leishmaniasis. And some of the strategies that are emerging as very promising as the immunochemotherapy strategies. Now we'll just, in the last part, briefly, I will present what we have been doing in the field of drug discovery and for Leishmaniasis mainly. So our main focus during the last 20 years has been anti-leishmanial drugs. And we have addressed the chemistry mainly of some of these drugs, so mainly the pentavalent antimonials. And from the very beginning, I had an important collaboration with the chemist, Cynthia De Micheli, and she really contributed a lot to the new synthetic process, understanding of the structure of these antimonials, which was not understood, and also the development of new complexes, as I will show to you. And other aspects that I've been interested in is the pharmacology, mechanism of action, mechanism of resistance and toxicity, development of nanocarriers, so to improve, as we illustrated, to improve the efficacy and reduce toxicity of these drugs, and preclinical assay. So these studies were developed in the University Federal of Minas Gerais, which is localized in Belo Horizonte, in the state of Minas Gerais. You see, we have the state here. And we don't have an ocean here, but we have waterfalls, nice waterfalls, and mountains also, so compensate. So one of the new complex, antimony complex that was synthesized, it's amphiphilic antimony complex that was obtained for the synthesis with salt, antimony salt with a surfactant. And if you look at the polar head of this surfactant, it is the same, in fact, that is in glucantime, which is a commercial drug, antimonial drugs. And so our idea is that with becoming amphiphilic, this compound would have an improved intestinal cutaneous absorption, and then could be used as for the oral treatment of Leishmaniasis or topical treatment of cutaneous Leishmaniasis. And here we are showing result more for oral administration evaluation. So it's pharmacokinetics of antimony after oral administration of the amphiphilic antimony complex and the glucantime comparison. And here we observed that we had a greater and more prolonged antimony level in the serum and in the tissues from the amphiphilic antimony complex. So, then we stimulated us to went to assay in a murine model of cutaneous Leishmaniasis, so Leishmania amazonensis. So we infected the mice on the base tail, and then it developed a lesion, and then we follow the size of the lesion as a function of time. So in the animals that were treated with, so we had the group treated with oral amphiphilic antimony complex and intraperitoneal glucantime, the same dose. So we had about similar reduction of the lesion growth in the case of the treated groups. And if we look at the parasite load, we have almost the amphiphilic antimony complex was almost as effective as the conventional drug, but parenteral drug. So it was nice results, encouraging results. Now, an interesting aspect also of this amphiphilic antimony complex that they self-associate in a solution, so they form nano assemblies. And we use different techniques to characterize, so microscopic techniques and SACs as an attempt to characterize these nano assemblies. And our data suggests that we are forming some micelles and micelles aggregate also. And when we look at the stability of these micelles, so when we dilute below the critical micellar concentration, we could observe the slow dissociation. So this means that we have a kinetic stabilization of this. These are kinetically stabilized micelles. And for this, because of this property, we have been interested in investigating their ability to act as a carrier of some other lipophilic drugs. And so amphotericin B, methoxsine, and in our collaborative project, we are investigating this the incorporation of some lipophilic derivative of two substituted quinolines. Another antimony complex that have been synthesized is, in fact, a cytotoxic. It's a metalloporphyrin, And why a metalloporphyrin? Because the iron porphyrin complex, which is M, which structure is shown here, is essential for parasite survival. So our idea is that this new complex or metalloporphyrin complex may be able to interfere in this in the uptake and the processing, intracellular processing of the M. And so we have synthesized this antimony complex here. And just rapidly, some in vitro results, the evaluation of in vitro activity in the intramacrophagic mastigotes have shown that this complex is very active at a sub-micromolar range and show good selectivity. So if we compare with cytotoxicity and activity. And it's very specific of the meta also, because if you use a bismuth complex, you don't have observed activity. Or if you have only the porphyrin, non-complex porphyrin, there is no activity also. So, and we are also now studying the mechanism of action. There is some evidence that it can inhibit the ergosterol biosynthesis, but we are also looking in collaboration with Philippe, Philippe's group, the inhibition of the possible inhibition of the M transporter. And there we had also during my share we obtained Julian in fact obtained interesting results regarding the in vivo activity of this complex. So we had in the model of visceral Leishmaniasis, murine model, we have a strong reduction of the parasite loads. So it's quite promising. And so the perspective, we are continuing the mechanism of action regarding this complex, studying the mechanism of action, potential reduction of resistance, which is ongoing, and development of nanoformulation. The last part that I would like to present here, it's our work that started about 20 years ago with a liposomal formulation of glucantime. So looking for a treatment of dogs with visceral Leishmaniasis. And so it's used a strategy of passive drug targeting. And so we first started with some large-size liposomes that were not effective in at least in the efficacy in dogs, naturally affected dogs, was not satisfactory. Then when we reduced the size, we were able to observe some reduction of parasite load in the liver and the spleen and lymph nodes. Now, one of more recent study, we associated the injected liposome formulation with allopurinol, which is given orally, and taking advantage of the synergistic effect of antimony and allopurinol. And then 50% of the treated dogs did not show parasites. We could not detect parasites in the liver, in the spleen, bone marrow, in the skin. And so this is one of the dogs that received this treatment that was considered cured, but in fact. And now we are evolving as an attempt to further optimize this formulation. We introduced the concept that by combining conventional liposome with long circulating liposome, pegylated liposome, we could have a broader distribution of the drug for the infected tissues. Because only conventional it will be mainly concentrated in the liver and the spleen. But there is the bone marrow, there is the skin in the case of dogs, so it's, we need to go beyond. And so this is a study that has been, last study that we have been done in dogs, in the naturally infected dogs. And so we had 4 groups here, mixed liposomal formulation, plus allopurinol, conventional liposomal formulation plus allopurinol alone, and non-treated group. And so allopurinol was given on a 5-month period, and liposome were given as 2 cycles of 6 doses with 4 days interval. And then we evaluated the parasite loads after the end of the treatment, and 4 months after the end of treatment also. And so this is one of the dogs that was treated with a liposomal formulation, mixed liposome formulation. So we can see a really clinical improvement of the animal. And in fact, we quantified this. We did a staging of the clinical state. We determined clinical state for each animals, and then we could compare the efficacy of the different treatment. So what we observed is that just after treatment, the liposomal mixed liposome formulation was significantly more effective, or could benefit or improve the clinical state of the dogs in comparison to the control group. And then 4 months after the treatment, we had a significance in relation to the control group, but also in relation to the conventional liposome conventional formulation. So it was quite a nice results. Then parasite load here we show only liver, spleen, bone marrow. So we had a reduction. This is before and just after treatment and 4 months after. So we have a significant reduction of the parasite loads, as you see here, that in relation to the pre-treatment period. So, and this was observed in both groups that receive conventional liposomes and mixed liposome formulation. Now, in the groups in the control group, we didn't see any significant reduction, neither in the allopurinol group. So it was very specific, induced by the liposomal drug formulation. And if we look more closely, we also observed here the higher effect of greater effect, improvement of the mixed formulation in comparison to the conventional liposomes. Now, an important question in the context also of the OneHealth concept was, did the treatment with liposomal glucantime may induce resistance, antimony resistance? So to try to answer to this question, we isolated at the end of treatment, we isolated the parasite from the bone marrow of the dogs. In fact, we were only able to isolate, because of the efficacy of the treatment, to isolate in the groups that received the conventional liposome formulation. With the mixed, we were not able because the treatments were more the higher efficacy. But in one animal, we could isolate a parasite, and we determined the in vitro sensitivity to antimony. And what we observed is that the sensitivity was not higher than what was observed in the control group or in comparison with the reference strain. So it seems really that we have here we have no evidence of induced antimony resistance. But well, it's only one animal, one strain, so I think we would need more time after the treatment to be able to have more parasites and to have a higher number of results. So it's not almost finished. Yes, I will finish here. So just to finish here, the perspective of this work and what we have been doing now with Philippe. So it's to apply our nanocarrier approach and expertise to other drugs. So amphotericin B, methotrexate, and mainly the two substituted quinolines, lipophilic derivative. We also intend to work with drug combinations, two leishmaniacidal drugs incorporating the same nanocarrier, and also to associate anti-leishmaniacidal drug with immunostimulants. So these are all the people that are currently collaborating, participating to this project. So many researchers, professors from the University of Federal de Minas Gerais, de Uberlândia, Juiz de Fora, Fiocruz de Minas Gerais, Université Paris-Saclay, groupe de chimiothérapie antiparasitaire, de l'unité Bio6, also from the Institute Galien regarding the development of the liposomal formulation. We have a collaboration with Sylviane Le Sieur, and of course the students are very important in this work and the continuity also. And I would like to thank also the funding agency, FAPEMIG, CNPq, Brazilian funding agency, and ANR also for the financial support. These are the photos of the students, and older one, but a more recent one. And I would like to thank also my dear friends and French collaborator for welcoming me in France. So thank you for your attention.
Thank you very much, Frédéric, for your very interesting lesson, focusing on OneHealth, the importance of OneHealth concept, because even the quality of drinking water could affect the result from a treatment. This is something important. Now we have the time for question. Yes, Daniel?
Thank you very much for your talk. I had a discussion with Charles Mowbray from DNDi, and he told me that apparently it's not acceptable to use the same drug in dogs and humans.
Yes.
And in other instances, in another meeting, some people were advocating for using new drugs in animals and humans at the same time. So what do you think?
Yes, as I mentioned, it's really a debated question. So it's there is a controversy because we do not have scientific evidence that transmission can occur of a resistant parasite. In the case of the zoonotic disease, from zoonotic, the parasite can be transferred from the dogs to humans. So, and there is some, the specialists are really, there is a discussion. Some of them think that this will not happen, or the probability to happen is very, very low because of the dilution of the infected cell fly in the sandfly population. So the probability so this, I think this is an important question that still need to be answered, because this is based on, I think that, but I think scientific evidence is missing. This is why there is this debate, and I think this would really be important to save the life of the dogs also, because if you believe that really it's not possible, so we don't have alternative drugs. All the drugs that are available would be available for dogs are used in humans, so we should not treat the dog. And then if you not treat the dog, so we have to go to euthanasia. So it's terrible. So I think this question is for me it's very very critical. It should be answered as soon as possible, because there has been many dogs that were sacrificed, and we don't know if it was useless.
Other question? Yes, Rodolphe?
Yeah, very interesting lesson. I had a couple of questions regarding the natural products approach. How is it guided? Do you have any evidence for local pharmacopoeia? I don't know how you say pharmacopoeia in English. How natural products are being used in local therapy, and searching for potential compounds which may be useful, or do you try just by random?
As in ourselves, we are not working in this field. In fact, this is a complementary aspect. But really, in Brazil, it's a very active field, and because of the biodiversity of Brazil, so And so there is many groups that are looking for natural drugs, so and to learn with popular traditional, yes, and this is an important field. So this is one of the, I would say, one of the priority in drug development research in Brazil. So we probably get more financial support. But I think
has there been any scientific studies about demonstration of the usefulness of some plants in traditional medicine?
No, it was that led to the development of drug development. No, I don't have this. Well, in fact, most of the drugs that are used, well, at least amphotericin B it's a natural product, so and it's probably the best drug that is used in for treatment of Leishmaniasis.
Has it been identified based on traditional medicine?
No, I don't think so. No. But for Leishmaniasis, but as I mentioned, for instance, in the case, for instance, artemisinin, it's really a case that it was based on traditional knowledge, the discovery of this compound. Now, how this is being done in Brazil, I think I don't know what will be the future of the Indian, but so it's something that. But it's something that there is some research line or groups that are working on this field. But for Leishmaniasis, as far as I know, I didn't see any really new natural product or bio-inspired products that led to that is really promising. So
no one is marketed up to now.
Yes, only yes.
And I had another question about the reservoir. So you said dogs are the main reservoir for visceral leishmania.
Yes.
And also rodents in Tunisia. Those are.
Yes, rodents was more. It was a context of cutaneous leishmaniasis.
Okay. And is it known why these animals are better? I mean, are reservoirs and other maybe closely related are not? Is there any investigation about what inhibits other animals to be reservoirs, which could be useful maybe as treatments?
Well, for instance, I'm not sure. I think Philippe will help me to answer this question. But I think just what I think I can contribute is, for instance, for the difference between humans and dogs, for example. Why dogs transmit or can infect the vector and humans no. So the main explanation is the parasite's density in the skin, where the phlebotomin, the sandfly will bite the animal. So if there is a sufficient density of parasites, then the sandfly will infect. And this in humans, for instance, in humans, the visceral leishmaniasis, the disease is more located in the viscera. And so there is a very low density of parasite in the skin. But in fact, if you look at co-infected patients with HIV, then you observe some different distribution of the parasites with, in the case of visceral leishmaniasis. And so then these patients can become a reservoir of the disease in some conditions. So this, I think this, in some cases, humans may also be a victim. Now, in the specific case of the wild animals, what determine their ability, the capacity to be a reservoir, I'm not sure. I don't know if you have some information.
No, there's the immune system, for example, the hamster, the leishmaniasis in the hamster are practically the same behavior than in humans. But in mice, you have to use biopsy mice. You have to, but in wild mice, you cannot install leishmaniasis because so there is probably immune criteria, not only, and also there is a competence of the vector because there is many species of sandflies, and only 20 of them are able to transmit Leishmaniasis, explaining that when all the environmental conditions are in favor of the development of Leishmaniasis, nothing appears. And this is the case in many areas, in tropical areas. This is a competence of the vector, which is maybe one of the first criteria, and also wild animals depends on their immune system, compatible with the development of the disease.
So concerning the treatments, the same treatment for humans and dogs, you said, if I understood correctly, that in dogs the treatment did not cure completely
Yes, there is no cure of the dog, so you have to maintain the dog under treatment for all life long, in fact. Because if you stop the treatment, then you have a relapse. And
the symptoms are different, the localization are different?
We don't know exactly, in fact. It's also an important question, I think, to understand why this happened. I think the distribution of the parasite, which is a bit different, I think is probably the main explanation. So there is some infection sites that are less accessible to the drug. For instance, I think it's probably the reason. But there's probably why the distribution is different. So there is some immunity, so the immune system, which probably has some difference between humans and dogs, for instance. So it can contribute to this difference.
Apparently there is very few data on farm animals. So farm animals are not really susceptible. But
you mean for Leishmaniasis? No, I didn't see. I've seen for cats. There is some cats can be affected, but now farm animals, I've never seen any report regarding this. Yes.
But probably cats is the affair for the pharmaceutical development, because in France there is more and more cats, and now the literature is more and more rich about feline cases of Leishmaniasis. But this is adaptation. Other question? Yes, Frank?
Do you have any knowledge about the presence or not of Leishmania and the corresponding diseases by the past in Europe? And I'm thinking mainly to the 1000 when you have global warming, and both global warming and life conditions which were not very good.
Can you repeat this?
Do you have any idea about the Leishmania and the corresponding diseases? Did they exist by the past in Europe, and particularly in 1000 year when there was a global warming and there was condition of life which were not or especially a disease from the Brazil and
in France there is an expansion of visceral, I guess, cutaneous leishmaniasis. It's more easily detectable from the dog point of view. So the dogs, so there is more and more dogs infected by visceral leishmaniasis, and it seems, at least what we have discussed with Philippe, that it was restricted to the south, but now it's going up, and I think this explanation would be the global warming that is contributing to this expansion. So the vectors is more can go up and can go to the more to the north because of the global warming, and so it is in expansion. But the number of human cases is low. So I think it's more important regarding the veterinary aspect than regarding humans.
I was speaking about the past.
the Middle Age.
Middle Age.
In the past?
Do you have a knowledge?
The past. I don't know. Maybe Philippe, no?
No, me too. Me too. In my knowledge, there is not a historical description of these cases, and mainly it was introduced through travels and so on. I don't know whether it was endemic, Leishmaniasis was or not endemic during the Middle Age in France. I cannot reply. Other questions? Yes, please.
Transmitted from the dog to the human. Okay. How does the virus is transmitted from the dog? I will go close with program.
How the parasite is transmitted from the
Oh, shit. Sorry. Huh? Sorry?
Is the virus transmitted from dogs to human?
How it is transmitted?
Yes.
Okay. Ooh. The sandfly, so how the dog, or the disease is transmitted from dogs to humans. So the sandfly will bite the dogs, will become infected. And then the infected sandfly will bite again the human. And then the vector will release the parasite in a promastygote form in the skin. There is different from two forms, promastygote and amastygote. And it will release in a promastygote form. It will be phagocytized by the macrophages, and then there the parasite can resist to the microbicidal activity of the macrophage, and it will remain in the phagolysosome, will remain and resist to the action of the macrophage, then will multiply, and then the cell will die and will release the amastygotes that will infect other macrophages. I don't know if it's...
Yes. If the dog bites
No, it's a vector, the sandfly that will bite the dog. The dog will not bite, so it's for the vector.
Yes. What I mean by that is, can the dog transmit the disease directly?
I cannot listen.
Est-ce qu'il peut y avoir transmission par morsure du chien?
No, I don't think so. No, it's not. It would not be sufficient, I guess. And the form of the infective form is really. It depends on the sandfly or the saliva sandfly to become really infective. So it's not. It would not transmit by this way.
Yes, a quick question about the use of repellent against the sandfly. Is it efficient as against mosquito or repellent? We can use repellent
Ourselves, you mean?
for humans?
I didn't see. I saw the insecticide or repellent insecticides, but to use on the skin, I don't think it would be advisable. But it's really out the inside the house. You can the walls. You will spray, but not for yourself. At least this may be a field, interesting field to go for drug development. But it should be safe. This is difficult, I guess, to.
And for animal, you have collars with a combination of several compounds. Yes, you cannot use them as repellent because it's a really insecticide. Little bit, yes, and a diffusion through the lipid of the skin.
Yes. I don't think we can use a collar for ourselves.
Do you have other questions before concluding? Other questions, other comments? So, thank you very much again, Frédéric, for your participation in this Cher d'Alembert adventure, and it is a real pleasure to collaborate with you and with the students. It's really promising for the future. And before concluding, you have first a gift. There is a gift for you from Université Paris-Sud, Paris-Saclay, sorry, Université Paris-Saclay. And there is a personal gift because I consider that the One Health concept is a good life. One Health concept include good food and good wine, and it is important for the life.
Thank you very much.
Thank you. Thank you.